When do we as veterinary professionals worry? These are the things that I have families watch for and have my staff also know is if a pet vomits more than twice, I want to know about it, or at least have my staff know about. This is not necessarily something that I would necessarily bring the pet in, but you want to know, and especially want to know if it's late in the week and you need to make sure that the family has everything they need in terms of anti-nausea medication to help the pet through. More than a day of diarrhea or not eating, especially if you're not seeing any improvement at the day and a half mark or so, to me means you come in. Not drinking for more than 12 hours in dogs, it is harder to assess if cats are drinking, but certainly watching that last point there, decreased urination for indoor cats, you normally could tell if you clean the litter box if they have smaller little clumped pee balls. And so that could be a sign of dehydration in a cat. Blood in the vomit or diarrhea to me means go in to either you if you're open or to an emergency clinic. I think that that is something that warrants an after hours visit if it's seen. And we'll talk a little bit more about this 4 day situation in a couple of slides. So if you see these gastrointestinal signs starting 4 or more days post chemotherapy, it could be that it's not just the gut being damaged, that something else is going on. Specifically, we worry about sepsis. And so that's where it really becomes ironic. And I discuss this all the time with families where I say, hey, you're going to be the most nervous when your dog first gets chemotherapy. You'll be like, I need to stay home work. I need to watch them, etc. But actually, you should be way more nervous if your pet is sick 4, 5, 6 days after chemotherapy than if they throw up a few times a day or two after chemotherapy.